Hi, good afternoon. My name is Maile. I am a nurse working at Kaiser Permanente Cardiology in Everett, Washington. I've been a part of the training fund for about 7 years or so. When I started working as a medical assistant, I used the training fund to help me with my prerequisites so that I would be able to go forward in my nursing career. I've always wanted to be in healthcare. I've always enjoyed really taking care of people and learning about new things. And with nursing, I'm sure as all of you know, you learn something new every day, and I continue to learn things every day. The human body never fails to amaze me. So about my nursing program that I was a part of, we started back in 2019, and we really started kind of when the thick of COVID happened. We were that first cohort to go through 2020 COVID. So that was quite challenging, but it never stopped us from wanting to do what we needed to do. This program was nice because I was able to work during the week and go to school on Saturdays, which was really helpful. I know for me personally, knowing that I was able to continue that, with money coming in and that livelihood, I didn't have to sacrifice everything to be able to further my career. And I know a lot of my classmates were also parents. I can't imagine having to, decide whether to further your career or to keep food on the table. So being able to have this part-time program gave these people who wanted to do better and wanted to do more, and wanted to further education, the opportunity to do that without having to sacrifice everything for that. And the professors really wanted us to succeed. We were very supported through the program. It was, having to change from in-person to remote learning was hard, but as soon as we were able to get back into the lab, back into the classroom, we did. And having that hands-on training was so helpful. I know so many places that didn't get that hands-on during COVID, and being able to go back into that class. We were all healthcare providers and healthcare workers essentially at that time. I worked with medical assistants, nursing assistants, wound care techs, emergency room techs. We all had this healthcare background. So being able to step into that place where we can further our skills, further all the things that we've seen already was awesome. The process of going through it was fairly simple. I was made aware about the program through my nursing navigator through SEIU, the training fund, because I was already a part of it. I was working towards my prereqs, so my navigator brought it to my attention so that I could apply. It was specifically for Kaiser and Swedish employees, so it definitely gave us an advantage of being able to continue our education. There are plenty of HEET supportive services. The training fund has amazing services. Being able to use the tutoring and, the extra financial pay for whatever reason, if we needed it for books or materials, that was available. The training fund is an amazing resource, and I tell everyone about it as soon as I can. And, just being able to have the opportunity to be supported and to further your career is amazing, because not a lot of people get that. Going back to school is hard. It's expensive. And, when you feel like you're constantly being hit with roadblocks, it's hard to keep pushing and keep trying to go through. So having the training fund and having these opportunities really it's amazing. I don't think I would have gotten as far as I have without their support. I mean, for regarding my future career goals, one of the reasons I wasn't able to join you guys today was because I am not currently now, but I'm going to be on a clinical rotation to finish up my bachelor's. So with the SEIU training fund, I was able to get my nursing license as well as further my career and education getting my bachelor's. I have one class left. I'm very excited. And I would like to get into education eventually when I'm done with the clinical side of things. And I know that if I was still with SEIU, that they would be there to support me every part of the way. There's so many people that I know and that I work with that are already putting in the work and want to work and want to do the work. So, any opportunity to be able to support them, I want to, and as soon as Sinitra reached out to me regarding this, I jumped on it as fast as I could because I know how important it is to offer these opportunities to people who want to put the work in. I work with probably 3 or 4 people who, if not have already finished their nursing prereqs, are in the process of finishing them, and they need options because they want to go to school and, you know, don't necessarily have the opportunity to. So I hope you guys all have a good rest of your day, and it was amazing being here, and I'm glad I was able to talk.